recording.
Good evening, everyone. Welcome to Manhattan Community Board 3's Health, Seniors, Human Services, Youth Education, Human Rights Committee meeting. My name is Maid Lee, and I am the committee chair. Okay. Before we start the meeting, though, I'm going to hand it over to our Zoom facilitator, Larissa Shainberg, and she will explain the procedures of the meeting.
Thanks, May. Good evening, everyone, and thank you for attending Board 3 Health and Human Services Committee meeting. I would like to remind everyone that tonight's meeting is being recorded. In order to reduce background noise during our meeting, we ask that everyone please remain muted unless you are recognized to speak. Throughout the meeting, our chat will be used for sign-in, materials distribution, and technical assistance only. So if you are experiencing any technical issues, you can drop a message in the chat and a facilitator will reach out to you to assist. At this time, we welcome all non-board members to sign in to the chat with your name and affiliation, if applicable, in our chat box for our attendance. Thank you. Have a good evening.
Okay, thank you, Larissa. So the first thing we're going to do is just review the minutes. And I sent it to all committee members in the last mailing. So can you review the minutes and speak up if there are any changes that you want to make to the minutes? All right, I don't see any hands raised. So that means that there are no changes and the meeting minutes are approved. Okay, so the next thing is we're going to have roll call. So Secretary Thomas Rosa will take the roll call.
Good evening, everybody. We're going to do our roll call. Maylee.
Here.
Thomas is present. Larissa.
Present.
David.
Oh, David is at another meeting for to rep CB3, so you can put down an asterisk.
Okay.
It means that he's excused for that meeting.
Eric. Eric Diaz. Shirley Fennessey.
Present.
Thank you. Deborah. Deborah, you with us?
Present.
Thank you. Alicia Lewis Coleman. Alicia?
Yes, I'm here.
Thank you. Laura Lugo.
Present.
Heidi Schmidt. Let me know.
She did say she would be late, but she's absent right now.
No problem. Ricky Wong. Is Ricky with us?
Here.
Thanks, Ricky. And lastly, Carmen Perez.
Present.
Always
present.
Okay, well, thank you. Okay, so we'll just move on to the meeting. First agenda item will be to continue our panel planning for the panel that we want to have in June. I sent, some of us did some homework, and there is a list of questions, draft questions that I emailed to you, and as well as very tentative list of speakers. Only one has been confirmed. So can everyone pull that out? Can everyone pull that out, look at the questions? Or should we also show it on the screen?
Yeah, could you share it on the screen? It would be great.
You want me to share, or can Thomas share?
Unfortunately, I'm on a mobile device and it's kind of hard to post things up. My desktop over here doesn't have a camera.
Well, I could share if you gave me some permission to share. I mean, if you gave the computer permission to share.
Is that coming from me or from Larissa?
I'm talking to Larissa.
Okay, thanks.
No, because you said you can't, right?
Yeah, I'm not able to do it from my mobile.
Okay.
Sorry, I don't have them up. I could go and pull them from my email, but my computer is a little slow tonight. See if I can find them quickly.
What are we waiting for?
Well, either Larissa can share it or she can give me permission to give May's computer
Oh,
permission
sorry, I
to
didn't-
share.
My apologies. I'm giving you permission to share. Sorry, I was trying to open it up. My computer's super slow. Trying to do a major cleanup on it this week. I still am trying to open my folder to get it out. Sorry about that delay.
So it's May's computer.
Okay, May's computer should be co-host now.
Okay. Is that good? Can everyone see? Bigger?
That's fine.
Okay, so those are the first 7 are the questions that were drafted. For those of you who've been on the committee for a few years, they'll look somewhat familiar because we readapted them from another panel that was on a different topic. So this is more on this topic, and they're meant so that so that any panelist can answer the question, based on their own information. So we have those 7. Some of them are in a question format, and some of them just say it should be a question about something, but we haven't phrased the question yet. It doesn't have to be 7. We can maybe reduce it to 5 or 6. And just in terms of the panelists who've been confirmed, Manhattan Outreach, Susan confirmed that already. Then there were some others that were suggested. I'm sorry, that's Citizens Committee for Children, not Concerned. I think it's Citizens Committee for Children, right? Yeah, so that it's a citywide advocacy organization, and then the door was suggested, and then I know Heidi's not here, but she suggested someone from DOE. But we also thought that they're an agency, and it would be good to invite DOE to come and listen. But we want a provider.
Who's reaching out to the door?
No one reached out to them yet, but we were just wondering if they were a good idea. So,
because if you want to, Paul's an easy contact.
yes, I know. So I know the door. I mean, they have a program for runaway homeless youth. I don't know. They probably have other programs too related to youth and shelter. Yeah, so we would ask him. So there's so first of all, look at the questions, see what you want to change or add or subtract, and then the speakers. We have we have Manhattan Outreach and a number of youth-related speakers, but we don't have, the other topic was more just about adults, and we don't have a provider for that. Besides Manhattan Outreach, but they're not a provider.
What is the issue? What would be the questions for adults? I mean, what would be the adult population? What would be the issue?
I don't know. I mean, for adults, is it just shelter?
It doesn't seem to fit in with all the others that you have on the panel.
No, we don't. No, it's a little different, yes.
Unless there are some shelters that are for families with young children, unless you had someone like that.
That would fit in better.
Yeah, I know
what other?
Henry Street has shelters, at least one, maybe more, for families with young children.
That are right in the neighborhood, right? In somewhere in
Right.
East Village, or
Right.
even maybe further down. Your
I know
office.
it's in CB3.
Mhm.
Sorry, I guess for me, I'm thinking about this, Shirley. I'm thinking about these are all sort of like post mental health issue supports in my mind, and I'm wondering if we need some kind of organization that does preventative work, or somebody from the DOE that can help us to understand how to navigate the whole, or health and hospitals, I don't know, to navigate the whole system, and where is preventative care available aside from folks in temporary housing or runaway youth. So can we look at, and I don't know what the organization is right now, but I'm just wondering if there's some organization that would be more on the preventative or the let's catch it before it gets to this point side that we could include in the panel.
Okay, so Shirley, so that's another discussion, another event. So this one, we envision it as a talking about the needs of those who are in shelter. So so then there's a lot of so it could be youth in shelter who don't necessarily have mental health issues, or maybe they could. So it's more like the services provided to them and their needs. And we know that, for example, during this whole COVID, I mean, right, we say that, there are several types of students are the most vulnerable, and students in shelter are at the top, right? So that's what we're talking about. For what you're talking about, we have another agenda item that CB2 is gonna, Human Services Committee Chair is gonna come, but we had this idea about doing another panel about mental health issues. It says mental illness, but also to talk about prevention. So we'll get to that later. Okay.
Great, thank you.
Okay, so maybe it is more about families then, not so much single adults.
So how is homeless outreach going to fit into what you just said?
Actually, maybe they don't.
That's what I'm thinking.
So, because I know so maybe we should say, I would say they don't fit.
Yeah, I agree.
Because they only outreach to street, right? To adults on the street, right?
Correct.
And
Correct.
there are no kids on the street usually,
Correct.
Okay,
So we should take them off.
yes, and then you can tell them that
Right,
another time.
right.
Okay, does everyone agree with that? If you don't, raise your hand, speak up. Okay, looks all right. Okay, so we will take them out. Okay, so Henry Street, we're saying, is someone we should invite?
Yeah, they have, I know they have shelters with young children. And they have family shelters, but I think they also have some where there's actually kids under a certain age.
Oh, okay.
And then they also have the family shelter that's on Baruch grounds.
Oh, okay. Do you know who to contact there?
I can ask David who to contact.
Oh, okay. Okay, so you'll ask David, and then we will ask Paul about the door. I
Okay,
can follow up with him. And then the Citizens Committee for Children. Well, that was Heidi's idea. And she's not here yet.
Heidi just popped in, so we should ask that again.
Okay. Heidi?
Yes, ma'am.
Right, so we're talking about, as you can see on the screen, we're talking about the panel and the speakers. And where this whole thing is focusing on, families and children, and also school-age children in terms of this panel on homelessness. So so we've decided that the door is good to ask. We're going to not ask Manhattan Outreach because they don't fit in, and we're going to ask Henry Street Settlement because they do run family shelters down here. Now, you also suggested Citizens Committee for Children. CCC, you said. Is that the organization you also suggested?
Yes, it is.
So do they fit in with this? And if so, who's a good, someone there we can ask, and can you ask them?
Yep. Yep and yep. And yep.
Yep and yep. Okay. So you're going to do that then.
okay.
Okay.
Heidi, can you email them and copy May and me?
Sure.
Okay, good. So now back to the questions. What do people think? Yes, no? If it's good, you should thumbs up or hands up. If it's not, make a suggestion.
May, can you just give me 2 seconds? Let me read it a little bit more, please. I'm trying my best to read it as fast as I can, okay? Because I really want to think this out and make sure that we're asking proper questions here.
Okay,
Okay, thanks.
all right. So just to review, these questions are what we would do something similar to what we did before. When the panelists have confirmed that they will speak, we'll send them this list of questions. They can send like a 1 or 2 pager back to us with, short answers. And then they will also, so just so we have it and make sure they're on target. And then at the event, that will be the content of their talk. So we'll put a time limit on it. And then, so they're answering, there's a structured format in terms of their presentation. And then after that, we can also open it to Q&A from the audience. And they can bring their brochures or materials about their programs, which they can distribute. And, there can be some synergy there between them and also with the audience. And as Susan mentioned in the past, some of them had never talked to each other much before, or, maybe they never had time to. So this is an opportunity for all. While we're waiting for Alicia, does anyone have anything they want to consolidate or?
I
No,
think
just
may,
with-
if I may interject, I'm sorry, go ahead, Susan, go ahead, go first.
And then, no, go ahead.
What I was gonna say is that I think question number 5, 6 and 3 could probably be condensed. Something
Okay.
about, I don't know, just some of the questions I think could be condensed and they don't have to, because I know they're gonna be open-ended for people to answer the questions. So, I think the most important thing to do is to find out, the population that they're serving, what their needs are, the basic needs, if they need help with mental health and, if there's any other activity that like to have funding for that will provide better services for the people, like maybe social work staff or something like that. What they will need further assistance with or whatever. How can we as or how can other agencies support one another around these topics or whatever it is that they need help with? I don't know. I just want to not have so many questions to ask, but just like anything that looks like it could be like around funding, just put it all together.
Oh, okay, so
If that makes sense, I'm sorry. I don't want to.
No, it makes sense. What services are fully?
Okay.
Okay, you mean like, so about the services they provide, right? And then what other help they could get from community-based organizations outside of themselves.
Exactly. Thank you.
Especially if they're school-based.
Yes, thank you, May, for understanding.
Okay, yeah, no, does that sound okay to everyone?
Yeah, and in line with what Alicia just said, I think which services and programs are fully funded is probably nothing, right?
Oh, okay.
What services and programs
So should we just delete it?
are underfunded and which which are not funded at all, maybe? What services and programs do you need that are not currently funded? So you're asking two things. What needs more money and what doesn't exist because they don't have money?
Mm-hmm. Yeah, you're correct. Nothing is ever fully funded.
Yeah, no one's ever said I have enough money for this program. And maybe with the staffing include, both funding and availability issues.
Okay, so question. Okay, so number 3 is which services programs are underfunded or unfunded? Questions. Some question about community-based services provided for or needed by the population you serve that can supplement the services that you provide. What are, I mean, how does that look for number 3? Any comments? Good, not good?
Yeah, May, that's okay. That's a little better.
Oh, okay. And then we still want to have the thing about staffing.
Yeah, but the second part of the number 4 doesn't go with the first part. What are your staffing issues? Do you mean what staff is not, what staff are you not funded for? I don't understand.
Yeah, I borrowed that straight from our senior citizen panel. That's exactly what it said. So,
I would
but
say
we
like
can change it.
along
it-
those lines, May, I would say something like, do you feel understaffed, or do you feel that there's a need for specialty staff like social workers or doctors or nurse practitioners, things like that, as an example?
Do you need other specialty staff?
Yeah, because you
So-
might have a need
Yeah.
for, like somebody might say, well, we have a need for a dietitian. We have a lot of children that have asthma or obesity issues, or, or families that have nutritional issues and things like that. So there may be a need for a dietitian, or, or someone that deals with nutrition services or something like that. Those type of specialty services. If they have social workers on staff, it might be overwhelming for a social worker to deal with. I have to also do nutrition. I also have to do this,
Yeah, I know. Yeah, there should be more. One person shouldn't do like 50 things. So, So we won't talk about the fully funded because we'll just have. Are we saying we'll just have this?
Yeah,
Is that it?
can you, for the specialty staff, maybe just say what specialty staff are you lacking, or are you lacking specialty staff instead of what is it?
Oh, okay. Are you lacking? And then they have to describe, right? So
Yeah. And
because
then
it's not just the yes or no question.
yeah, and do you have staffing issues because of availability or funding, or both?
What do you mean by availability?
They can't hire people, and there's not people out there to hire.
Or if they can hire people, May, what happens is they can't hire them for long hours. They can only get them for like maybe, 10 hours a week or something like that,
Yeah, but it's just tremendous labor shortage.
Yeah, yeah.
Can we guess that they will just tell us?
That they what?
That they will just tell us that. If we say, what are
Okay.
your staffing issues?
Okay,
They'll tell us, we don't, they don't have enough
Okay.
funding, they can't hire, their salaries are not high enough, they can't keep
good
them.
point. Good point.
They must be talking about this all the time if it's an issue.
Yep.
Yeah, so when we say issues, we mean problems that need to be, solved and to make the staffing better. Do we need to ask a question about their facilities?
Yep.
Okay. Is there a way to word the question?
I'm trying to think, are there, I don't know. I mean, the state of the providers' facilities, I think that, what are there any open repairs that need to be made in the facility, or expansion of space? Do they have accessibility, to mobility and all of that?
Should we say then, do you have any facilities issues and what are they?
Yeah.
Okay, yeah, that's an open-ended, that's a good one.
Okay. Okay, so we must skip number 2, which was, because it was at, somebody suggested that we should have a specific one about the health and mental health services most needed and most effective. Yeah.
I mean, that might be along the line of the specialists. I mean, I don't know. But I mean, no, mental health is something by itself. If they're able to provide mental health services at this time, or do they need, further assistance with hiring mental health staff? Or do they currently provide mental health services for, maybe that? Do you currently provide mental health? And if so, is it adequate enough, for the population that you're serving? Or would you need further, support in that area or something? I don't know. Somebody help me out.
I
There's a lot
think
of us on here that work in this area.
I think the way you had it was fine. I don't
Okay,
think you need more.
okay, thank you.
Well, what do you mean by the way she had it?
Well, do you currently provide mental health services? Are the services you provide adequate for your needs?
Adequate for your needs, adequate for the needs of your population, right?
Right, right.
Okay. All right. And then the final one, pressing needs and challenging issues.
I think that's fine.
Okay. Do we want to have a number? Do we want to? I had challenging issues in the next X number of years. Do we want to put a number to that?
I mean,
Or
that's
not
like
say
a
it at all?
budgetary issue, May. I'm thinking that's more on the line of budget because a lot of people, they basically what's been going on is like they may have the budget that'll support them for the next 2 years. So they may not know what the budget will be for the next couple of years after that. And a lot of these providers, they, it's a kind of like a hit and a miss from year to year, whatever funding they can pull out.
Can you just say short-term and long-term pressing needs?
Yeah, that sounds good.
Challenging issues?
Yeah, it wasn't, okay. Yeah, it's not necessarily just short-term or long-term pressing needs and challenging issues. Yeah, it's not just about funding, but, it's also about in light of the current state of things. So it could be a little bit more,
more along the needs of, what their projected needs may be.
It could be.
Yeah, so it could be just the current
housing.
state, or, it could be housing, or,
It could be classrooms.
Got it.
And challenging issues. Like if there's any changes in trends, so then it might present a challenge.
Like
Right.
the increase in very old people.
Long-term. What do you think on the short-term, long-term pressing needs and challenging issues? Yeah, so I gave some examples of, things that might bring up those issues. But that's just that those are only examples. There could be others too. And so people think a little bit more like strategic and long-term, or that's the answer to give. Okay, so there are 6 questions now, and Can everyone, are we good with these questions? Yes.
For now, yes.
Okay. Okay, Deborah says yes. And Laura says yes, and Alicia says yes. Okay, so let's just look at these. So we'll use these questions, and you know, if you have any other wordsmithing, that's fine. But these are the topics that we will use that will for the panel. Okay, and we have the list of providers we will talk to.
So that's what I wanted to actually mention about. I think it's kind of difficult to tell DOE to come, but they can't talk.
Oh, okay.
I mean,
Well, I kind of think we don't have to tell them to come.
or do you want to have them respond to issues? I don't know. It's just that if you want them to come, they should engage somewhat.
Yeah, no, if they come, they should respond. For those of you who have experience with central office, I mean, many of their staff are wonderful, but they tell you what's supposed to happen or what, not what is actually happening. And then someone has to tell them, oh, but this is happening instead. And then they go, okay, I'll take it back. So.
Yeah, that's
Yeah, but they're very nice people, I must say, but that's just the way it is. So are you saying it's hard to invite them but not ask them to be on the panel? Or maybe they could be on the panel to respond?
Yeah.
I don't know.
Let's leave it open. Let's leave it open for now, May. Let's not just,
Oh, okay.
I would like to leave that open.
Okay. Well, okay. So how long do we want to leave it open? Because how much time do we need? We need to invite
about
people.
Another week, or give me another week.
Okay, so there
we
was
can't make a decision. We can't make a decision outside the meeting.
So the suggestion
What
here
decision needs to be
specifically
made right now?
whether or not we want to even invite them.
So
See, so
I
this
would,
Should, of course we should.
No,
I think we should. I think we should have their input, whether we agree with it or not, or whether it's, informative or not. I think that we need to have their perspective, and we need to include that in the way that we're thinking about how we're informing district needs, because this is an equity issue. If we don't invite the DOE and we don't really have a good picture of even their imagined services, however we want to think about them, I don't think that we're really being fair to the system, whether the system is functioning or broken. I don't know. I feel like we should include them if we have a contact there that could help us with this.
Okay, well,
That's
there's a
my
specific, okay, yeah, no, that's fine. So the specific suggestion here is the executive director of the students in temporary housing. So there's, so that's the suggestion. And the question is, are we going to invite them? And then what is their role? So they can't answer the same types of questions, these 6 questions, because they are not a provider. However, they are a city agency. And yeah, so so when we invite them, I mean, it seems like there's sentiment here to invite them. And, well, Deborah, did you have a question or want to say something?
Yeah, I did have a question. Inviting the DOE, but you just answered my question that it didn't seem like these were questions that they could answer. I guess my thought or my question is, would we be setting them, are we asking them to respond to the individual providers and the questions or concerns that come up from the providers? Like what, I guess maybe it's just me. I don't understand what they would have to add, I guess, vis-a-vis the groups that are going to be coming to answer these questions.
are they providing more context? Are they saying how they support or supplement these services? Are they saying what they need? I'm not really clear of their role. Thank you.
Yeah. So those of you who were, who said we should invite them, did you have a clear idea?
I guess for me, I would want them to provide context and, they're looking at service providers and then they can talk to what they're actually providing themselves or what their ideal is, or however they're thinking about the way they provide services for students in temporary housing. And then, I guess part of what I'm thinking is that we're thinking about how are we collaborating with these services? So what do the services need to know from them as, to what they're doing, and then what services are being provided that they may or may not know about. I guess, yeah, the context would be the thing I'm thinking about as far as the relationship with this in them and the panel.
So you're saying they hire staff that provide services directly?
I don't know about that, but they could provide context around what they're doing and what their initiatives are, and then they can hear from the panelists and maybe provide context for the panelists.
Well, some of these are community-based.
Of course.
I 100% agree with Shirley. I think we need to invite them. I think it is an equity issue, and that even if we go in knowing that what they say is going to be either redundant or irrelevant or late knowledge or imagined services, as you said, Shirley, I think they should still be there, and at least they're listening and we're facilitating kind of these discussions.
Okay, so so you're saying they should
describe
sit
their
up on the
initiatives and
panel,
their
right?
programs?
We're both talking
What-
at the same time, we couldn't hear.
I'm sorry, is what everyone is saying, or is it included to have them describe their initiatives and programs?
Yeah, I think so.
Do you think that they could, well, Laura Lugo says yes. Could they focus in on our area?
No.
Sometimes they talk very broadly about the whole city.
I mean,
It's a good idea to tell them.
I've seen that happen before. I mean, it's great information they give you, but
I mean, you should ask them. That's part of the
Okay.
process, right? Yeah, ask them.
Yeah.
Laura, could you stop sending me direct messages and just because I can't. Could you just speak up, please? It's not open. Oh God, I don't know what Laura's trying to say. I can't tell.
May, I
yeah.
think that they would be able to speak to the area because I have a resource I'll put in the chat. I mean, I'm pretty sure everybody here is familiar with open data from the city, and you can see a progression over the last 4 or 5 years of the stats per school. And it's very interesting that a lot of the schools in our district, citywide, is about 4.5% of the students are in temporary housing, and it's different categories of what that means, like residing in shelters and or in temporary living conditions. But a lot of the schools in our district are well above that. Some of them are like upwards of 17%, 12%. So I think, since we have the data, it's public knowledge, I think they'd be able to speak to it. And also there've been a lot of monies coming into the schools recently. We just got about $40,000 as a community partner and to do some work with CBO. So they might be able to speak of something that's specific towards homeless as well.
Who? I'm sorry. Who might also be able to? Can you repeat that?
No, they may be able to speak to possible federal initiatives that would be funded for homeless students, because we received supplemental funding for community partners recently. And I know we were allocated $40,000. So it's quite possible there may be monies that are already being distributed that they can speak to that we may not have known about. And I think some of the providers who are at this meeting may benefit from knowing about that.
Okay, so you're specifically talking about someone from the Students in Temporary Housing from central
Yeah.
office, right?
I'm
Okay,
pretty confident they could speak about that. Yeah.
Okay. Well, that would be helpful. To resources, they could respond. Well, I don't know how much you want them to, well, it could take forever. There's the resources or funding.
Initiatives and programs
Okay, initiatives and programs.
focusing on CB3 area.
Okay. So what they're talking about is a little bit different from the others, but if what we feel that would be helpful. So who's going to contact them? Laura?
Yes,
Did you
that's what
say-
I was trying to say. I was back and forth. The chat is only going to you. The chat is not open. So that's why I was going to you directly, May. But thank you.
Yeah, I know, but I'm not looking at the, I'm
There
not
is-
looking at the chat, okay?
I
I
got
can't.
it.
Yeah.
I got it.
Laura, this is Larissa. The chat is, I can see the chat as well, but you were messaging
can
me
I.
directly.
Yes,
So if you
yes.
drop something in general, I can read it if you're having issues.
Thank you, Larissa. I appreciate that. I was saying that I was getting in contact with the district STH coordinator for the area. That's why I was asking for an extra week. But Thomas spoke to it, the additional funding that was created, that was given to the DOE for these positions. So that's who I was trying to mention earlier, that I will have in the next week a name.
Oh, it's an STH coordinator for District 1?
Yes.
Oh, that would be good. That would be wonderful.
So are we excluding District 2?
We do, yeah, we do have
me.
schools in CB3 that are in District 2, and some of them have high numbers of students in temporary housing, like 2 of them.
Okay, I'll reach out to both and see what I can do. I'll let you know via email, May.
Okay. Right, so it's the STH coordinator in D1 and D2. Okay. All right. Is there anything else to talk about? All right, so just to review, we have Laura's going to get the contact for the STH coordinator in D1. See also if there's someone in D2. Susan is going to talk to David Garza about who we can contact at Henry Street Settlement. I will ask Paul about the door. And we will, and Susan will tell Manhattan Outreach Consortium that they're not needed at this particular forum. And Heidi will talk to the Citizens Committee for Children.
Agreed.
Okay. So if we are done here, we can move on to the next agenda item, which is, I will stop sharing the screen. One moment. Okay, our next agenda item is to talk about the letter. Can everyone pull out the letter?
Gonna share screen with that?
Yes. Oh, no, it's not it. Sorry. One moment. Okay, so this is the letter. It's very long. Is that big enough?
Yes.
Okay, so so this is the letter that we're, a draft of a letter that we are to send to Councilmember Eric Bottcher. It's follow-up to his presentation he gave us about his 8-point mental health plan. And I basically what there is here right now is there is a little intro paragraph and then a summary of what what committee members talked about during the meeting, you know, kind of their first impressions of the plan or other things that they wanted to see. So we would, and then we need a concluding paragraph to talk about, you know, if we want to talk about exactly what we want to do, like, you know, whether it's to have another meeting with him or follow up on certain points. So questions, comments? Deborah?
Yeah, so I guess the first paragraph, many mental health problems present themselves in late teen years, but things can be done earlier to prevent the crisis, such as, that should read social emotional learning,
Mm-hmm. Okay.
and in parentheses, SEL, close parentheses, in schools. And then my question about the rest of it is, when children are in mental health crisis, the need for coordination among hospitals. Is it focused on inpatient information, or are we not thinking about providing outpatient information and resources? So that's the question that I had, because it talks about parents have to research by themselves. So is the focus on inpatient services? Thanks.
I recalled that Shirley talked a lot about that. Shirley Fennessey.
Yeah, I mean, I have a lot to say about that.
Okay, so right now her question is, what do
Yeah.
you mean? Is it outpatient or inpatient?
Or both. I'm just curious if it's specifically focusing on providing resources for inpatient services for late teens and children.
Yeah, you just kind of open up Pandora's box for me, but there is a lack of all kinds of services for teens and late teens. Currently, there is a really long wait list and no new patients for any PHP program in the city. There is no therapeutic healthcare schools for anybody in the city. Yeah, I mean, sorry, you asked me the wrong question. I don't think I
I'm
can answer this
sorry.
question, but it's this is my current situation, and I'm super passionate about it because it's really problematic and we need to do something about it. And sorry, I don't even know how to answer your question. I'm sorry, Deborah. We don't have service. We don't have preventative service. We have a preventative plan somewhat in the schools and SEL plan and some other, additional counselors, et cetera, but we don't have any post inpatient plans. We don't have any really good outpatient plans. We don't really have any therapeutic schools. We don't have any dyslexia schools. We don't have anything to really help our kids in this incredible world that we're living in, where, suicide is the #1 cause of death among 10 to 18-year-olds or 10 to 21-year-olds. We just don't have a plan, and it's we're in an epidemic right now with this.
Okay, so Susan.
I'm sorry,
Shirley. Okay, I'm just
Sorry.
trying to, I was listening to what you were saying. So could we say that there's a need for coordination? It's not coordination and planning, maybe, and planning. So parents know what resources are available for their child, and that could be in hospital or out of hospital. So this is specifically is for children in crisis, right? So the first part talks about this. So how many preventative things could be done, like in schools, or schools have a
Sure.
role. And then the
Sure.
second part is about when the children are in crisis. There's a lot of resources. It might be hospital resources or non-hospital resources. And there needs to be coordination or planning so that parents, they have like a program or something to follow and not just run around and try to find out things by themselves.
I'm just going to tell you like the full story. So my kid is in a 90-day program, and the DOE has sent paperwork to somebody, and there's supposed to be a coordinator. She's never contacted me. All of a sudden I start getting calls from White Plains and Yonkers and Hawthorne and Great Neck about these therapeutic schools. I have no idea why these people are calling me. I don't know if the school sent the therapeutic school sold my information. I have no idea. So finally I talked to a school today, and apparently the Department of Education doesn't have any therapeutic schools that are appropriate for kids who have been hospitalized for whatever reason. And so they outsource to these districts that are an hour away. They pay for busing. Nobody contacts the parent. And then you have to research all the schools. You have to figure out by, the 15 schools that call you, where you're going to send your kid outside of the city for an hour bus ride. I mean, I'm sorry, but this is a really ridiculous plan. We have 1.1 million students. We have amazing educators in the city, and this is the solution, to send them to Hawthorne on a bus? I'm sorry, I'm sorry that I'm telling you the real deal.
Okay,
Because anyway, so that's why this is like not a good, we need to do something about this. It's a
okay,
problem.
I'm trying, Shirley, that's fine, but I'm trying to also, I mean, I understand all your problems, but I'm also,
And
can
then-
we look at this? I'm also listening.
Of course.
So we're talking about the need for coordination and planning, so parents can know what accessible resources are available for their child, hospital, non-hospital, inpatient.
Right, and there needs to be a plan in place where there's a point person, there's somebody to contact, there's a plan where they know that they need to go to this particular person at the DOE, pre-hospital, post-hospital, whatever the situation is. I didn't tell my story just to tell my story. I told my story because there is no plan, and we need to figure out a plan. There's nothing in place. There's nobody to contact. There's no process in place. There's no system that tells you, okay, here's what you do when your child is an inpatient. Here's what you do when your child is released from inpatient. Here's what you do if there's no partial hospital programs available. Here's what you do if there's no appropriate setting for your child.
Okay, Shirley, can you take a look at the paragraph and see if that captures what you're trying to say? Can you read it quickly?
Can I make a
Okay,
suggestion? This is Larissa for that,
Yeah.
kind of summing up, and correct me if I'm wrong, Shirley, because I went to similar frustrations when I was dealing with getting services for my son.
Yeah.
We need more funding for improved case coordination.
Yes, exactly. You got it. Thank you, Larissa. I knew that you would understand this.
Oh, totally been there, done that.
Yep, I know.
So is it called coordination in general or case coordination?
We need case coordination because
Yeah.
we need funding, improved funding, and increased number of case coordinators at the DOE who will be responsible for reaching out to parents.
Yes, exactly.
And
Telling them the
coordinating and
process.
following up on services that they're recommending and schools
Yep.
they're recommending.
Yes,
Okay, thank
exactly.
you, thank you, Larissa.
Sure.
Thank you. Perfect.
Okay, so read this. Larissa, can you take a look? Is that what you mean?
On your.
I would add improved case coordination.
Mhm.
Okay, it's not like there's none at all, but
No, yeah, that's
yeah,
the
there's
problem.
some,
It's
but
just not
it's very
good.
lacking. Okay, it's very
Yes.
lacking, okay.
Yeah, so
Well,
parents
they're
know
stretched
what
very thin
accessible-
and they're it's underserved for sure.
Yeah, parents often have to research by themselves. Yeah, and then yes, I think this is perfect. This tells us a lot about what the issue is right now.
Okay, great.
Yeah. Thank you. Sorry.
Anything else on other sections? Especially abuse, so each of you had spoken about it a little bit. That's where the sections come from.
May, is there any way to make the font a little bigger for me? I'm sorry.
Then you won't
Oh, then you won't be able,
see
okay.
everything, but
never
yeah,
mind.
I could, but this is how you see everything. I mean. well,
Okay,
maybe
okay.
just-
Don't worry about it.
Oh,
I'll do my
okay.
best. I'm trying
And
here.
instead of making your font bigger, can you maybe just zoom the screen in a little bit more? Maybe
Yeah,
that
that's
will
it.
be-
Thank you.
Yeah.
Thank you. Just a
No,
little
no,
bit.
that's what I'm gonna do, but
Okay.
yeah, no.
Yeah, like, yeah, just a little, not 100%, because you might, okay, that's perfect.
Okay, so the senior citizens is on the bottom.
Thank you, May.
Anything else? Okay, I'm going to wait a few more seconds.
Hi, May. I just think it needs a proofread.
Okay,
It's just there's some little, I mean, the ideas are there. But it just needs a basic proofread.
like wording proofread.
Like people living on the street with mental illness would like to see on this covered in a plan.
Okay,
What does that mean?
Shirley, Susan, you're the one who brought that up.
But I just said we'd like to see this covered. Oh, I guess his plan didn't cover it at all.
Yes, that's what
Is
you
that what
meant.
it was?
Yes.
Okay, but it's would like to see on this covered in a plan.
Oh, we'd like to
We'd like to
see,
see a plan. We would like to see a plan to,
That covers this. That's it, you know?
no, I think more than that. We would like to see a plan for outreach to people, unhoused people needing mental health services.
we'd like to see what the,
We'd like to see a plan
That
a
provides.
plan.
that provides resources.
Yeah,
and
resources,
coverage.
okay.
Provides
For people.
resources.
Resources.
For unhoused people. No, it's not gonna make sense in my part for. I would say who need mental health resources.
What, to see a plan for people who need, for unhoused people who need mental health resources?
Yes. Unless someone has something better.
Maybe you could write something, add something about harm reduction.
But that doesn't go under the mental illness.
I mean, sometimes it does.
Yeah.
Harm reduction goes along with like drug addiction, Susan.
I know, but we're saying then you want to add people on the street with mental illness and substance abuse
Okay,
needs
yeah, that sounds good.
Is that what you want to add?
and substance abuse.
What you think, Heidi?
Yeah, that's perfect.
Who need mental health resources and was it harm reduction services?
Yep.
Like that.
People living on the street with mental illness and substance abuse needed.
Oh, some substance abuse. What? What is the word? Needs? No.
Needs.
Yeah, okay.
Okay. Right.
Substance, not substances. Right?
Yes. Yeah, this thing needs a like a spell check and proofreading, grammatical
We can
proofreading.
do that later.
Yeah, but right now. Okay, then there was students with special. Let's start from, okay, we covered youth, we covered people living on the street with mental illness and substance abuse needs. Anything else? Resources for low-income people of color.
Hey, can I just ask for clarification for that paragraph?
Yeah,
People in crisis need to stay in hospital more than 2 weeks. However, mental health hospitals are overwhelmed some are doing facilities, but not well enough. It might just
No,
be
some
me, I don't
facilities
understand
are
what that means.
doing well, but not, oh. Hey, Alicia, you talked about this.
Yeah, actually, so I don't want to get into the whole long drawn out thing, but it's like there are some of the city is pulling people off the
That's what you
street,
meant.
putting them in mental health facilities for short period of times, but some of them need long-term care. So if they need long-term care, they're sending them up to state facilities, and the state facilities are now becoming overwhelmed. So, yeah. And if they don't get placed in a state facility, they put them right back out on the street or into like temporary housing situations that are not ideally what they need, you know? So
Yeah,
that's,
so you're,
yeah.
So is that
We need
sentence?
to Return in inpatient psychiatric beds. They need to.
Yes, that I agree with you, Susan. So that, how can we word that to put that in there? Like that we have to return some of these hospital beds back to longer term psychiatric care.
so funding for inpatient psychiatric beds have been cut, right?
Yes.
Yeah. Yes,
Tremendous.
and that's a major issue that people are talking about.
Mm-hmm.
Have been
Well,
cut,
it's
and
not
they
just
need
the-
to,
It's not just the funding. They've changed the beds from psychiatric beds to,
COVID.
with other kind of COVID
Yeah.
and physical illnesses.
inpatient psychiatric have been cut, and they
Well,
need
you
to be
just say-
returned.
Inpatient psychiatric beds must be returned to pre-COVID levels and increased.
Yeah, because Susan, I think like we went through this with Beth Israel, Mount Sinai, and they said that they, reduced their in-house the beds to accommodate outpatient treatment. And now we're looking at, since COVID, the increase of needing more psychiatric beds.
Oh,
So even
So-
before COVID, we were having issues.
yeah, so return and must be increased.
Yeah,
Oh.
that sounds good.
So the numbers of inpatient psychiatric beds, right? That's,
Yes.
must be returned to pre-COVID and must be increased, okay. And be increased, okay, all right. Yeah,
I was just thinking from people in crisis up to a need for more clubhouses. Is that just redundant now? Can you take out that part about the need to stay in hospital more than 2 weeks? It just seems to be getting more into what type of health, how to treat them as opposed to what is needed.
well, the clubhouses was different, right?
Yeah, that's what I'm saying, to leave that in, just up to that. I don't
So what
know.
do you want to do
The
exactly?
clubhouses are just
Everyone
outpatient
sees-
support.
What?
The clubhouses are outpatient support is different from in-house.
That's what I'm saying, to leave that in. I don't know what they are, but I know everyone thinks they're wonderful.
Yes, they are. I know exactly what they are.
Yeah, no, I'm saying this 2 sentences before that, I didn't know if we needed.
So what, so you want to leave it as it is, or you want to move things around, or what?
Never mind, just leave it. If people are happy, you'll leave it as. I was just trying to streamline it.
Oh, okay. So we need the clubhouses, we need the inpatient, more of the inpatient bed to return and to be increased.
Right,
And yeah, I'll probably have to. And it is because people need to stay in the hospital more than 2 weeks. Yeah,
Well,
I
it's
think
a
we need
lot
to
more
rearrange
than
the
that.
sentence.
it's a lot more than that. They don't have beds for people being there one day.
Okay. All right. Okay. Okay, we'll streamline it a little bit. Anything else for the others? Students with special needs. There was another about Thomas. Is that all right? Students with special needs?
Yeah, that's strong, because I just wasn't clear on, initially when it was funded, we were told it was like a 2-year contract. So I want to see what assurances they could give for continuing the services of the social workers.
Okay.
Can I make a suggestion on wording?
Yeah.
Instead of, is there a possibility, can we just say funding is needed to continue this beyond?
Oh, yeah, that's much stronger. Funding from city or state?
I
Or
would
just
say
say funding? We don't
city
even have to say where it's from?
I don't think we need to. but-
Okay. Is that right?
Yeah.
Take out that question mark. Okay, does that look good to everyone? Okay. Okay, so finally, we have 2 more things. We have people with mental health issues when they are in between services or leave a hospital. Is that repetitive with the, well, the other one, the one above, that they were talked particularly about low-income people, but this is just the general thing about people with, oh, this was
Yeah,
about the case management,
Yeah,
or,
this is
you know,
yeah, that's what this second to last one is, right? It's
yeah.
like case management. So along the lines of case management, I think that there needs to be more case managers assigned. Well, I don't know, like some health insurances have really great services for case management and some do not. So the interagency communication is a plus. I do
Mhm.
like that wording. I just know that there is a serious disconnect when a person is released from the hospital back into the streets, back into, like, if they are a person that's going home to a family or support system in place, they succeed better than those that are going back into like temporary housing.
Can
Okay.
you put case management is
Yeah,
needed for post-hospital care?
yes. Okay, Susan, those are good words. Yes. Thank you.
Where should that go? Should that be the title?
Yeah,
Yeah. Right there.
You call it case management.
yeah.
Case management is needed for post.
Hospitalization, psychiatric hospitalization. Or mental health, psychiatric.
Well,
Yeah.
it's psychiatric. I'll respell. It's a typo. Psychiatric hospitalization.
Yeah.
Or more improved case management, or more, or
No, because some patients will have case management in place because of their medical insurance. Like, you know, some of these health insurance
Oh, I see.
they have nurses and, you know, follow up and things like that. But if they don't have the, you know, the services provided, they go home with nothing, you know, they
Oh,
might get a
okay.
phone call. but some people don't even have telephones. So how you gonna call them?
Oh, okay, so this is what you're talking about, right?
Yeah.
Okay. All right. Okay, so finally, if there's nothing else on this, we'll just look at the senior citizens.
Can I go back to
Yeah.
that paragraph? I think
Sure.
that sentence that says there is community-based and faith-based network of many programs, I don't think that adds to what we're saying the need is.
We should take it out.
Take out that and just say need, no, leave it, yeah, there a need for more interagency communication.
You mean
Um,
like that? Is that what you don't talk about it at all?
Well, I would,
Because someone said that there are these, I forgot who said it, but there is some,
May, if I
Yeah.
could interject here, actually, this is something I was going to mention this evening. That would go really well. I think what you're talking about are the community health workers. This is a program that's being implemented in health and hospitals. Basically, these are health workers that work with those who do have behavioral and mental health issues. They provide services to help coordinate care for those people and improve their health outcomes. Maybe this could be a request for an expansion of that program. They do reach out for mental health services, maybe specialty services, general health, including home visits to help them make improvements to
do
their
you want to
health outcomes. Yeah. So
that
if you
one of
could,
the, like that
sure.
over here somewhere?
Yeah, if you could include that, so request an expansion of the Community Health Workers Program.
Larissa, do we know that all the hospitals that are providing this service?
I'm just trying to look that up actually. It's being implemented at health and hospitals. It's at Gouverneur right now. It's an amazing program, and they're using former test and trace employees who are no longer, who were let go just recently or redeployed in different places.
do they have
that's
any
trying to find.
healthcare training?
I'm sorry.
Do they have healthcare training?
They have healthcare training, yes.
Specifically, do they have mental health care training?
No, there you go.
Oh, good questions. I know for sure that they do have healthcare training.
Yeah,
Because in
mental
order
health
to
care
be a
training is
test and
totally
trace
different
employee,
than health.
it
Yeah.
is absolutely different. But in order
Yeah,
to
the
be
city's
employed by the
just
test and
dragging
trace, you
people
had to have
around.
medical training.
City's just dragging people around to fill spaces, like they're taking nurses out of schools and putting them in the subways to work with homeless people.
Oh, goodness.
After, maybe you have the idea there, but not this specific program. Because the program might be different in different hospitals.
Okay, so maybe we could ask them,
Isn't
ask
it case
for if
management? Isn't it still case management?
it is case management, but it's much more intense. The case manager would, for example, could do a home visit to see what improvements could be made in the home to improve health outcomes. They could coordinate services if they needed to see a dietitian or dermatologist or
Larissa,
any type of service.
That's basically what case managers do. I mean, I was a case manager before, so
Oh, okay, but
they do home visits. They do, the client comes to the office. They coordinate all services that the client needs, and the family, if there's a family involved, they connect the family to the services. So that's exactly what case management is.
yeah, and they follow
Right.
up on, yeah.
Can I suggest one word where this says need for more interagency? Can we add coordination after that?
Yeah.
Okay, so Okay, so what about this community health workers program? Do we not want to mention it? We have something about assigned staffing.
It is, it's just, it sounds like it is a case management program.
Okay, so we don't need to.
Yeah, because it might be called something else in another hospital.
Okay. So does that look all right then, everyone? Yeah. Okay, Larissa, is that okay?
Yep.
Okay. All right, so finally, the last thing we're going to is the senior citizens. Carmen, did you have anything to add to that? There's just a bunch of phrases, but in terms of content.
All right, I'm looking at printed out a copy. Here it is. Those belong to systems for daily living activities. Issues are not being dealt with. Okay. I guess we could expand on what we mean, you know, what's going on here.
Yes.
Let me see. Because I even had to deal with a situation like that today. Because loneliness does make matters worse for seniors, especially now, since we're like right in the middle of a pandemic. There's only so many places they can go to and so many people that they can see. And a good many of the, what I would call friendly programs, they're not visiting the homes right now. So there might have to be some type of expansion of virtual visiting, calling, if that's the case, and putting money for those type of programs.
Virtual and in person?
If they can, because many of the
Yeah, okay.
many of the in-person programs have shut down for the time being.
But so do you want to mention it, or you're just saying right now there's need
Absolutely,
for
it
the
should be
virtual?
mentioned, because
Yeah, I mean,
there
in-person is very
have been
important.
pilot programs for virtual programs, but
Mhm.
I don't know what the results of the pilot programs were, because it was mostly in Queens, so it didn't spread into, you know, other parts of the city.
Okay, so so you're so when you talk about dealing with the you said mental health issues are not being dealt with. So your one proposal is to expand the friendly visiting programs.
Friendly visiting programs, right? That makes a world of difference.
Okay. All right. Okay, so I put that in there, and just that's what you want to say, right?
Yeah, that makes a world of difference.
Okay. All right, great. Okay, so what are we going to do now in the end? What are you going to ask for? We want to have just let him know, or we'll get back in touch with him. Anyone have ideas on this?
I'm sorry, May, can you repeat the question?
Oh, no, right. So we may have these points, and then so the last conclusion is, we're just letting him know, do we want to have another meeting with him or talk to him? What is our conclusion? Like next step?
I wouldn't ask for another meeting because it's not good use of his time, really.
Okay. Or should we just leave it at that?
Can you ask him to say, we hope he, continues, and I don't know what words to use, continues promoting this plan and, and let us know how we can support it. I don't think my wording's very good, but it's just the idea.
Yeah, I know. Okay, we'll think of something. Okay, so this is it. We may do a little wordsmithing. So she make the last sentence sound a little better. And this is, oh, so are we voting on this and then sending it to full board?
What do you need to vote on there?
I don't know, I'm asking.
I mean, I guess you can. We're not taking a position or, doing anything. I guess, there's no reason not to vote on it.
Well, we taking position supporting his plan.
That's true.
I mean,
Then
not everyone necessarily agrees with his plan.
that's true.
Okay, so can we maybe do this all at the end?
Do the vote at the end?
Yeah. Because we only have this one thing.
You tell us, Madam Chair.
Okay, we'll just do it at the end when we take the roll call. Okay. Okay, so we're done with this. Our next agenda item is the CB2, CB3 event.
But Susanna's not here, right?
Right. Is there a reason why she's not here?
Oh, she's had a very bad month.
Okay,
Very, very bad month.
all right. So should we talk about this another time?
Sure.
Okay, I just to let everyone know, after as I said in the email, after the last committee meeting, she actually had this idea about doing a forum about mental health, mental illness, and because it's come up so much. And we had a short call with her, and it wasn't just to deal with like the mental illness crisis you see, in the city right now, but also, talk about dealing it from a preventive measure, because as a preventive way, because you hear many stories of these people who as adults are like, are having many problems, but if their issues had been dealt with when they were younger, and also when they were minors, under the care of, of an adult, it could have been better. The outcomes could have been better, but it's not. And here they are adults, and, you can't like forcibly, do things. I mean, you can't forcibly like, have them undergo treatment. So she was supposed to come to this meeting and we would talk about it more. But since she is not here, we will have to put this off for another time. Okay, so our next thing will be CAB and CEC reports.
Excuse me, May, just a point of clarification. Who's the person that's not present for the for this portion?
Oh, okay. Her Susanna Aaron. She is the chair of CB2 Human Services Committee.
Okay, thank you.
All right, so now we're gonna have the CAB and CEC reports. Laura, I know you
May-
went to a CAB, yes?
Oh, sorry, go ahead.
I did. I went to the Lower Manhattan Presbyterian Hospital CAB. And we were told by Juan Mejia, the senior VP, that they're still partnering with AmeriCares and AFIA org to donate supplies and resources. The hospital is finally open to having all surgeries that are not just life-threatening. They're operating pretty normal, but I think we have to keep in mind that that was last month before this new variant came out. So I'm pretty sure we're going to hear different news coming up. There are no new COVID cases within the hospital. And a wonderful fun fact that I found out was that that hospital was founded by the first female doctor that was ever given a medical degree. And that was the first all women's hospital. So being new to this area, I thought that that was an amazing fun fact.
What was her name?
Dr. Elizabeth Blackwell.
I thought that was it. I read her biography when I was in 6th grade and I was so thrilled.
Amazing
Okay,
story she has.
Okay, so thank you, Laura, for going to the meeting because Ricky couldn't make it.
And I still haven't heard back from Bellevue.
You know, I've tried following up with the borough president's office and I don't know what to do.
That's okay. All right, so Larissa?
Yes, I did attend the Gouverneur CAB meeting. We had some really great information that came over during the meeting. First of all, as I mentioned earlier, the Community Health Workers Program, which are former test and trace employees. The program currently has 5 of these workers. They are expanding to 6. They have 1 focused on pediatrics, 1 solely focused on behavioral mental health. They have a Spanish speaker and 1 Mandarin speaker. Currently, there are 50 patients enrolled in the program. They focus on patients who are experiencing homelessness, who were recently incarcerated, those who have aged out of foster care, and those with behavioral mental health illness. So right now, as I said before, that they can go do home visits, they can coordinate any care, make suggestions for services, and it's being very well received with patients. There's a lot of requests for that. Let's see what else? We also met with Rafael Dominguez, is the new Director of Community Affairs with Health and Hospitals. He's focused here in New York. He will be the outreach for all 5 boroughs here in New York. They are actually hiring. Their staff is multilingual. They are looking for Mandarin speakers to have some Spanish speakers. Currently, they have 5 of the 16 members that they need right now. What he would like to focus on is getting information out to local community organizations, such as faith-based and community-based healthcare organizations. Our committee made a suggestion that he also reach out to the NORCs here, the Lower East Side. So if you do know anyone, any organization that would like some information on services that are being offered at Gouverneur or any of the health and hospitals, just reach out to me. I can pass on his information to you, or pass your information on to him, and he can have one of his staff members reach out to you. And the last thing is very exciting. Gouverneur is moving forward with their dialysis center. This will be an in-house dialysis center that will offer services to their skilled nursing residents. Currently, they have to send their patients out for dialysis services which is time consuming for the patients, and they also are limited to the number of times that they can go out. Having the services offered in-house will give them the opportunity to have smaller sessions more often if they need it or want it, and have them just go basically come downstairs. Right now, they've got the go-ahead for the certificate of need, and they are currently putting together the safety plan for how they can mitigate services during construction. Okay, that's my report.
Okay, thank you, Larissa. Were there any other cabs or CECs that we went to? All right,
Can I,
yeah, Susan.
can I say something about what happened yesterday?
Yeah, and we're gonna also go into future agenda items too, but you can say something about what happened yesterday.
Well, maybe that might be a future, I don't know if that'll be an agenda. I don't know if everyone's aware that on 9th Street yesterday in front of 605 East 9th Street, which has scaffolding, it's Char's. And there have been, I guess, a small encampment there, a couple of people living there for a while. And the police came to clean it yesterday. They came with a strategic response team and another police team. And then there were protesters there saying, leave them alone. And 6 protesters were arrested. 1 homeless man was arrested. The other homeless people were removed. Their possessions, including tents, were thrown in the garbage. There's videos of all of this kind of all over, so we know it's true. And it just seems there's a lot of people, I think, want to respond in some way to this. I texted Carlina's office, and she said that she wanted to know if the committee had ideas, but it's not really on the agenda for us to discuss. But she said, she'd stand with the board, if there was any ideas of what they wanted to do. I don't know if you want to put it on a future agenda item. This is going to keep going on, but it was really aggressive. It was really aggressive.
Yeah, I mean, I think that it's his whole, the mayor's whole plan, right? So this was the more aggressive one, and also people pushed back, but
Another thing is the regulations seem to be changing. They used to have to post several days in advance saying, these possessions are going to be taken. Now it seems they're posting 1 day in advance, which, doesn't give much time, like for help. It just seems like there's a lot changing, that doesn't really seem to be an effort to help people.
Okay. Yeah, so some of those things can be on a future agenda, but was there also some thing about wanting to react immediately to this event yesterday? I mean, if that's the case, then it can't be decided today. I mean,
Yeah.
I know Paul said it could be put on exec,
Yeah, I mean, I don't know what could be done. He had said if, Carlina wanted support on anything, but she's saying, if the committee had ideas, she would stand with us. So I think people don't really know how to respond. It just seems like, there should be some kind of a statement about this.
So a statement about this event, and then also another statement about these things that are changing under this new administration.
Not even, just this one event. This one was at our home and it was widely videoed, but about this type of aggression.
Right, yeah, and it's, there have been other articles about it too, in other places like in Brooklyn, for example.
Yeah, it would be nice to have an immediate response, but I don't know that there is anything we can do.
Okay.
Particularly considering that, we cannot have it as an agenda item this month.
Does everyone want to put it on the agenda for next month? Yeah.
Yes.
Okay. Okay. Okay, so let's talk about the agenda items. So we're going, so I think, one of the standing features of these meetings will be to have a short discussion of future agenda items for future meetings. I know I always tell you, send me an email and all that, and nobody really does it. So, so we could have a short discussion at this meeting. We're not going to make decisions about the agenda items, but just talk about whether or not we could have it for a future month, and doesn't have to be next month. It could be after. So so Susan, just one idea is the talk about the response, the city's current responses to street homelessness. Oh, just to let you know, we received a request from Housing Works to give us an update about their needle kiosk program, because they had started some new stuff.
Right, he confirmed that he can do it next month.
Oh, okay. So they're not asking for any support, but just want to
Right.
give us an update. And they came to talk to us about it before, when they were starting.
Well, I think he also wants to talk about how it's working in both of our parks.
Oh, okay. Anything else about, it doesn't have to be about homelessness, it can be in any of the areas that we, and it doesn't have to be just for next month. Sometimes it turns out you may have an idea, but it's not, you need to work on it more, or it's not feasible for next month. But this is a way just to discuss, some content of future meetings. Deborah?
Yeah, it's something that Shirley said earlier reminded me, I don't know if there's any, whatever happened with the space at Essex Crossing and the school. I know that there was some talk about trying to, maybe a dyslexia school. I don't know. I don't know whatever happened with that. And just, I'm curious if there's any way that we could sort of revisit it and see where that is, or if it's something that we're letting go. Yeah, I don't, it's been a while since we talked about it.
We were supposed to meet, follow up with Department of Education, I think. Isn't that right, May?
Yeah, well, we were supposed to make sure that we got the extension on the land in writing. And
That's exactly what
under
it
the
was,
last
yeah.
administration, I don't know if it's the same people there, they said, was it with HPD or they were very,
It was HPD, and what we need to do is get an extension on the land.
and they were very supportive of the general idea of a new school at the time. So, but we never got anything in writing about extending the space for the land. So that's one thing. And then the other
And
thing
what was it? Wasn't there a time limit on that? An expiration was
Yeah.
2023?
That's why we need to get the extension.
Yeah, so we have to follow up on them and on that. Susan, are those people still there?
The people, last time we spoke to people, it was at DOE, correct? Or was it HPD?
HPD, DOE was not there. It was, the
Okay.
purpose was only to get the extension on the land.
Right, so we need to follow up with HPD. Yes, and I have to go back. I don't remember who we met with. Do you?
Maybe there's an email, but I don't remember them offhand.
Yeah, so what we need to do is see if that person's still there. If not, we can
Okay.
find out who has replaced that person.
And then in terms of DOE and the school, that's another thing that we have to do.
Well, we need
their
to get an
last-
extension first, because
Yeah,
we don't get an extension, there's no place to have a school.
right. So Deborah, does that answer your question?
Yeah, and I'm guessing that whichever school, I forget, the middle school that was possibly interested in the space, they sort of went back on that. Was it Was it Institute for Collaborative Education? Was that them?
Yeah, I haven't kept track of them. They were the ones who wanted to move into that other building. And I haven't kept track of how that's going. They wanted to move into the Marta Valle building.
Right. And I know at some point they were making noises about being interested in whatever new space, if there was a space that was going to be had. It's been a while, so I don't
They
remember.
never followed.
Where it is.
They never followed up.
They never followed up, and then, I mean, they were making noises, and, you know, I mean, it's a two-way thing. I mean, if it's a building that's not built yet, I mean, what is there to follow up on immediately, you know?
Yeah. Thanks.
If I could just mention this, I noticed on another community board's agenda that they invited independent budget office to come to the committee and talk about how the budget cuts for DOE in the next fiscal year, how it'll affect their schools. And I just wanted to mention that if there was anything similar that the committee wanted from IBO, that, you know, they do come out and talk about budget issues.
What do we say?
Pardon?
What do you guys think? No, I'm asking committee members for, are you interested?
Yes, I think that'd be very interesting.
So would it only be for education or for? would they
Whatever.
be able to- Yeah, sure. Always want to talk about money.
Well, you'd have to let them know what, you know, what you wanted them to speak about, whether, like I said, it was education or some other, you know, some other cut agency.
Yeah, I mean, they do a lot of different studies. Sometimes it's about funding, and sometimes it's just about, you know, different trends. But
Maybe
you
you
know,
want to look at their website and see what looks interesting.
okay. So maybe Thomas, do you want to look at the IBO website to see what kind of studies like that are of interest to us?
Sure.
Yeah, I
I'll
mean,
look
they've
into
done interesting things, you know. So
Okay.
years ago, they did one on students in temporary housing, but
Oh, did they?
yeah, they mainly studied the elementary school level. You know, their performance in school, how, you know, it affected their performance in school. Okay. Anything else for now? Okay, looks like we have some stuff for, you know, the next upcoming meeting. And as I said, we'll have a short discuss. This will be a standing item for every agenda. But if there's anything in between meetings that you wish to throw out, like an idea, feel free to send an email. Okay. All right. So we are at the end. And I think we can have the final vote, right? Vote to adjourn and also vote on that letter.
And the vote is to have the letter presented to the full board?
Yes. So we're
Okay,
taking a position, because it's taking a position in support of the plan with some additional comments.
Okay. So I'm just going to be asking 2 questions then. Is that correct for everybody? Or are you just going to do one each?
Just do one.
Just do one, yeah. So, yeah, if you're voting no, you should say no.
Got it.
And
Okay.
one-
For the attendance and for that.
One
that,
thing, there is going to be another sort of sweep through for just sort of grammar fixes and like little tweaks, right?
Yeah, this needs to be a lot of grammar fixes.
Thank you.
Okay,
I mean, I can send it out to everyone before, full board is not till like 3 weeks later, so I can send out the grammar fixes. Okay, very
all right,
good.
that helps.
But as long as we can have the minutes by next Thursday.
Sure. Okay, so let's get our vote. Mei Lee,
Yes,
okay, Thomas is a yes. Larissa,
Yes,
and David's at a meeting, asterisk.
Yeah.
Did Eric make it?
No.
doesn't look like it.
Okay, Shirley,
Yes.
Deborah,
Yes.
Alicia,
Yep.
Laura. Laura Lugo,
Yes.
okay, Heidi,
Yes.
Ricky didn't make it, right?
I'm here.
No, Ricky. Oh, Ricky, I'm sorry. And what is your vote? And what is your?
Yes.
Okay, thanks. And Carmen.
Yes, and with any necessary emendations.
Okay. Thank you.
okay, so the meeting is adjourned, and we'll see you at the full board meeting, which is the last Tuesday in April. And